Hello and welcome to our video on the different blood groups and their importance to transfusion. My name is Dr. Frederick Clues and my assistant is Miss Spila Acula.
Dr. Spila Acula. Doctor.
Yeah, okay. As we all know, the main transport method for oxygen around the body are your red blood cells or your erythrocytes.
Now on the surface of your erythrocytes
are protein markers that are responsible for the four basic blood groups A, B, AB and O. Not to mention rhesus factors.
There are numerous other blood groups, all with their own...
Yes, but we're not going to be talking about them. I've told you this already. Now, are you going to let me continue? Thank you. We don't know why there are different blood groups, but we do know that mixing them during transfusion is generally a bad idea. This is because your body develops antibodies in the plasma to attack foreign blood cells and cause agglutination.
Now, the antibody system is really easy to remember.
So easy to remember, even Miss Acula here can understand it.
Dr. Acula.
So you keep saying. Anyway...
So, if you blood type A, then you will have A antigens on your surface. If you have a B blood type, then you will have B antigens on your surface, like this. Now, if you're AB blood group, then you will have B antigens and A antigens, just like that. If you're blood group O, that means you don't have B antigens or A antigens, just like that. So, this cell is type A because it has an A antigen on its surface. Now, if you add this little thing over here, that will make it positive. That is a Rhesus D antigen. So, if you have that, you're positive. You're A positive in this case. If you do not have it, then you're A negative.
So, if a person has type B blood, they'll have millions of A antibodies in their plasma, which means if they're transfused with type A blood,
then basically what happens is that the A antigens will agglutinate with the A antibodies, and it's really a bad thing. We do not want that at all.
So it's Landsteiner's law that states that if you have
an A blood group, you will have A antigens and the exact opposite antibody, which in this case B antibodies. And if you have a B blood group, then
you'll have A antibodies
and B antigens. Easy as such.
Okay, I'm sorry, I'm feeling a bit faint. Can we cut to the footage in the hospital, please?
I think that's a really good idea.
I think I need to go and lie down in the dark room.
You should go.
Hello, we are in the pathology department of Gwynedd Hospital. I am joined by Mr. Trevor Roberts, and we are going to be showing you the slide agglutination test for determining blood groups.
We're now going to demonstrate the hemagglutination technique. So what should happen here now is the A antibodies will bind onto the A antigens. It'll cause the red cells to clump together. It's called hemagglutination, and we should end up with large clumps of cells, and you can start seeing it developing here now.
This is a negative test.
So whilst the slide method is very quick, very simple and a very easy way of determining blood groups, in a high throughput situation like a clinical setting in the hospital, it's much more effective to use machinery like the one behind us. So how does this one work exactly?
Right, well, this machine works on the basis of what we call column technology. I have this card here which has got the same reagents as what we had on the slide earlier in these plastic columns which have got microscopic glass beads in them. When we have a reaction, the raft of red cells are unable to pass through the column when these are centrifuged, and you end up with a button on the top of the column. Whereas a negative result, the red cells are able to pass through the column and you end up with a button in the bottom of the column.
So in a year, how many tests do you carry out and how many transfusion requests do you generally get?
Well, in a year we do about 26,000 blood groups, and out of those we transfuse about 8,000 units of blood components, and that would be either red cells, plasma or platelets.
Why is it important to get the correct ABO group?
Right, there are several blood group antigens, some of them which can result in quite a nasty reaction, but the ABO, getting the ABO blood group right is crucial, because you only need about 10 ml of the wrong blood group and you can have a fatal reaction.
So what sort of procedures are there in place to prevent any wrong transfusions from occurring?
Well, as I showed you the machine earlier and I told you how secure it is and there is no human intervention, the results are transmitted into the hospital LIMS, we call it database. The actual database has an algorithm in it which will actually block the release of the incorrect blood group, so it's a very safe system.
Okay. And our final question is about the Rhesus Factor. What is it and why is it important for pregnant women?
Right, okay. The Rhesus Factor is based on the Rhesus D antigen. And what happens in a mother who does not have that antigen, if she's exposed at any time to the red cells of a child who is Rhesus positive, she can elicit a response against that. She will produce anti-D. So there is then a risk to subsequent children from that anti-D crossing the placenta and causing what we call hemolytic disease of the newborn.
Excellent.
So thank you very much for your help today.
No problem.
Here we have a table similar to one you're likely to see in an exam, and I'm going to show you the results you're likely to see and how you can understand that and interpret the data. So it's split into two sections: forward grouping and reverse grouping. Forward grouping is when you mix a patient's cells with stock serum, either anti-A, anti-B or anti-D for the Rhesus factors. Reverse grouping is when you take the patient's serum and mix it with stock A cells or stock B cells. Now the example I'm going to show you is for B negative blood. As they are B cells, you're unlikely to see a reaction with anti-A, no agglutination. With anti-B, because they're B cells, you're going to see agglutination and have a positive result. Now because it's B negative, there's no Rhesus factor present, so there'll be no reaction with the anti-D antibodies. And similarly, reverse grouping will show the reverse result but indicating the same thing. So the patient's serum will react with the A cells but won't react with the B cells, giving a result for B negative blood. The next example I'm going to show you is O positive. Because it's type O, you'd expect no reaction from either anti-B or anti-A stock serum. However, it's O positive, so there's Rhesus factor present. indicating you'd get a result with the anti-D serum. Now the reverse is again true of reverse grouping, so you'd end up with a positive result for both A and B cells when mixed with a patient's serum. O positive. I'm now going to show you an example that you can work through yourself, and then at the end I'll be able to tell you what it is and you'll be able to see if you've got it right or not. So, there was a positive reaction with the anti-A serum, a negative reaction with the anti-B serum, positive reaction with anti-D, negative reaction with the A cells, but a positive reaction with the B cells. Oh, come on, it doesn't take that long. Seriously. You know what, I'm just going to tell you. It's A positive. If you got it right, well done. Next time speak a little louder so I can hear you. Well, all this talking of blood groupings making me thirsty. I'm going to go grab a pint.